Hi, it's Mark Cantrell doing a video presentation on the healthcare systems of the United States versus Uruguay. In this discussion, we'll be comparing the costs, the benefits, and who is covered by coverage in both countries, as well as who has the edge, the United States or Uruguay, and what it takes to become a healthcare provider in both of these countries. Alright, so let me start off by first explaining healthcare. As described in my paper, you'll find health is one of the most important aspects in anyone's life. According to the World Health Organization, or WHO, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Healthcare systems focus on promoting, maintaining, and restoring health or preventing exacerbation of health problems, which may arise from a conglomeration of several multiple factors like genetic inheritance, the physical environment, the social environment, as well as an individual's behavioral and biological response to these factors. As you'll see throughout the PowerPoint, we'll discuss the healthcare system in the U.S. first. Scholars and researchers describe the condition of the healthcare system of the United States as complex and fragmented in such a way that it lacks centrality and universality, even though it has expanded service in the recent years due to changes in political climate. For example, the Patient Protection and Affordable Care Act of 2010, or commonly now known as Obamacare, since it was enacted during former President Barack Obama's term, has established the shared responsibility between the government and the employers and has expanded the health insurance of citizens to ensure that all Americans have access to affordable, good quality health insurance. The Organization for Economic Cooperation and Development reports that life expectancy, or the average length of time that a human lives in the United States, is lower than most in other countries due to several reasons, such as poorer health-related and risk-related behaviors like higher alcohol consumption, obesity rates, and highly fragmented nature of the U.S. health system. The healthcare system of the United States employs nearly 18.4 million healthcare service providers and professionals, including doctors, nurses, dentists, pharmacists, and administrators, as well as about 451,500 physical, occupational, speech therapists, and rehabilitation services. Institutions in this healthcare system include around 5,686 hospitals, 15,663 nursing homes, and almost 2,900 inpatient mental health facilities, and 15,900 home health agencies and hospice services. It is also approximated that 201 million Americans have private health insurance coverage through their employers, while around 103 million are covered under two major public health insurance programs, which are Medicare and Medicaid, which are both managed by the United States government and state government levels. With this, there are around 452 licensed health maintenance organizations referred to as HMOs, and 925 preferred provider organizations referred to as PPOs, as well as a multitude of government agencies involved with the financing of healthcare, medical and health service research, and regulatory oversight of the various aspects of healthcare. Now let's discuss the Uruguay healthcare system. Healthcare services in terms of the percentage of the population who can get treated for their healthcare concerns and problems, as well as the percentage and effectiveness of healthcare services for treating those problems in the Latin American and Caribbean region, has dramatically improved since the 1950s. Uruguay, or the Eastern Republic of Uruguay, is a country in the Latin American and the Caribbean region that is bordered on the west by Argentina, on the north and northeast by the Federal Republic of Brazil, and on the east and south by the Atlantic Ocean and Rio de la Plata. Uruguay has a staunch commitment of achieving universal healthcare coverage for all of its citizens from all ages. Uruguay's constitution will provide free preventive care and assistance to indigents in order to address the issues related to health and public hygiene in order to achieve physical, moral, and social improvement of the Uruguayan population. The Ministry of Public Health was then enacted in 1934 to be responsible for the establishing norms regulating the sector, developing preventative programs, and administering their assistive services. In 2005, a reform in the healthcare system in Uruguay was launched wherein explicitly prioritizing equity, financial protection, and change in the healthcare model, and recognizing people's rights to health protection. By 2007, the National Integrated Health Systems and the National Health Insurance were established to form the premise of effectiveness and efficiency in economic and social terms, and to adopt and integrate healthcare model that would create a common set of rules for health insurance coverage, including the unification of previously fragmented insurance rates across subsystems. With this, it provides health care benefits to previously uncovered formal workers, their children under 18 years old, and economically inactive citizens through public or subsidized private services, and expanded further on it in the next years. Now let's compare the two systems. For the facilities in the United States, it has government, private, not-for-profit, and private for-profit types of ownerships of hospitals. The numbers show that acute care hospitals are around 5,764, and with 965,256 beds as of 2003 data. Uruguay, on the other hand, has identified 105 hospitals. 56 are public, 48 are private, and 1 university. Furthermore, the total number of beds available in 2008 was around 11,132, including the beds for nursing home and mental health facilities. Comparing the healthcare workforce. The healthcare service workforce in the United States comprises of about 13.8 million people in 2004, including physicians, nurses, pharmacists, dentists, and physical therapists. Data from the Continuous Household Survey of the National Institute of Statistics showed around 43,327 people worked in the Uruguayan health sector in 2008, with approximately 20,031 doctors and 10,168 nurses. As you can see, it's a great disparity between the amount of employed providers in the United States and in Uruguay. The education that is provided in the United States, for medical schools and such. The United States, there are 170 degree-awarding medical schools currently, as well as several hundred institutes that provide degrees for other healthcare-related employees, such as nurses, therapists, dentists, and other healthcare-related fields. In Uruguay, there are 2 main providers of healthcare education, where one is public, which is the Faculty of Medicine at the University of the Republic, and the other is private, University Institute, CLAEH, C-L-A-E-H. Faculty of Medicine at the University of the Republic has around 1,200 students every year, wherein half of the population graduate as doctors after finishing their study. So 1,200 students a year, 600 approximately graduating as doctors in Uruguay, compared to universities versus 170 in the United States. Financing healthcare. Here's another difference. In the United States, the money for healthcare services originated from the general population, transferred via the government, insurance, and managed care companies, and direct out-of-pocket payment. So basically what we have here is we're funded by employee contributions, we're funded by employer contributions, we're funded by government subsidies, and we're funded by private organizations that will provide healthcare insurance to patients that can't afford it. Whereas in Uruguay, Fondo Nacional de Salud, or FONASA, is financed and funded through mandatory contributions from workers and companies, contributions from the state and non-state public persons, and contributions from retirees. Basically, anybody in Uruguay can buy into the system. Whether you're a citizen, whether you're an expat, you move there, expat meaning you come from another country, relocate, retire, and live there, you can buy into their healthcare system. You don't have to be a citizen in order to receive the healthcare benefits. The management of the healthcare system is also pretty different. The United States unfortunately lacks any central governing agency for its healthcare system and has little integration and coordination with public and private financiers. Although regulating agencies such as CMS that oversee Medicare and Medicaid providing facilities and providers. So we have the CMS compliance, which most hospital workers will attest to. It's really important if you've taken Medicare or federal government money or Medicaid money, you need to make sure you're CMS compliant and follow the rules. They basically give you guidelines stating, this is what we require in order for you to receive money back or reimbursement for payment for services that were provided by hospitals, physicians, clinics, things of that nature. Meanwhile, in Uruguay, the Ministry of Public Health is the one who puts order in the healthcare service sector and regulations in the care provided. It has two bodies that aid in carrying out the order, mainly the National Health Board, which is the coordinator and responsible for administering health insurance, and the General Health Directorate, which is the main health agent responsible for administrative services and epidemiological surveillance and sanitary regulation. In conclusion, comparing the two healthcare systems, the system in Uruguay mostly has a better edge and advantage because of its attempt to provide universal health care to all citizens or members of its communities. This is a great benefit. This is something that we all should strive for, that every person, no matter of the ability to pay, any walk of life, can receive the same quality health care across the board. In the United States, we have a lot of positive aspects, and we are improving. We have outstanding facilities across the country with world-renowned physicians. We have the best available equipment, but we still lack the compassion to make sure that everyone has the services because we're still, in most cases, chasing the dollar. I believe that once we become more in tune with universal health care and the ideal that one service provider versus opening up for multiple providers will actually benefit everyone. When people say, oh, well, we need more competition in insurance and healthcare, it's false. What we need is everyone to have the same so everyone's treated equally. Right now, the way healthcare is distributed based on what insurance provider you have or whether you have insurance at all is grossly misrepresented in the fact that who gets service, who gets a surgery, who gets medication, and that really needs to be, just done away with. I mean, we need to get to the point where, regardless of what you have, where you come from, you're provided the best possible health care that's available. Just like rich, poor, blind, crippled, whatever, you get it. You get the same. So as you can see, I'm a big proponent of universal health care. Many years in the healthcare industry and experiencing it firsthand on both sides, seeing the administrative side as well as the clinical side, and have seen these issues. I chose Uruguay to compare to because, again, their doors are open to anybody. You just come down, and the cost relative to the services is pretty astronomical difference. In Uruguay, for a single person, you're looking at probably about $150 a month for coverage that will provide you hospital coverage with probably a $6 to $8 copay, doctor visit copay about the same even if you have a copay, and everything, your procedures, your surgeries, all with that little minimum copay, and like I said, about $150 a month, compared to the United States, where the average employee who has employer-based will pay in excess of $300, $400, $500, $600 a month with usually large deductibles as high as some catastrophic plans, $5,000 or more. So you can see that we have a long way to go. We hope that we take the politics out of it, and that we really look at what's best for our country, our citizens, and our future, and start with improving our healthcare system in the sense that we all are equal, that everyone should have the same. Reduce the burdens on emergency rooms, reduce the burdens on doctors having to make decisions based on what insurance will pay and won't pay. Make it about quality of life and improving that. And with that, I'll close. Have a great evening.